An ever-familiar image of Africa during drought. Parched and dusty lands, little or no water, crops burnt out, and hungry people. In Asia, it's the opposite of weather conditions. High tides, floods, ruined crops and communities. Experts say this will occur in the future because of climate change. The dry places will become even drier and the wet places even wetter. These extreme scenarios and what can be done were at the centre of a Commonwealth Foundation conference on climate change, water and health.
The impacts of climate change in the next 10 or 20 years are going to happen. They're now unavoidable. And there will be significant impacts on human health and on water systems in particular. Diseases like malaria are going to spread, other vector-borne diseases are going to spread, and there will be malnutrition as well.
So what we are really looking at is how can communities really adapt to those changes. They are vulnerable, they are in vulnerable situations, living in drought-prone areas or flood-prone areas already. Now, if you're talking about more serious droughts or more severe floods, and it becomes part of their daily life, how do people actually integrate these things into their normal life? How do governments look at climate proofing? What's the responsibility of local governments and local service providers to make sure that the serious situation on the ground is not further aggravated?
The conference concentrated on what could be done to improve the situations across Africa and Asia. Many countries already suffering from climate-related disease, such as malaria.
There are two solutions. The first one is to get to know better exactly what's going to happen. What I've described is a very general statement. We really can't say with a lot of precision what is going to happen exactly. Better modeling, better science is going to be needed to do that. But at the same time, we also need to be precautionary and take measures to prevent the spread of diseases where we think it's going to happen, even if we don't know with a great deal of precision how much it's going to happen. And that would mean better healthcare facilities, better public health, and obviously in the poorer parts of the world where they have a hard time dealing with the problems today, they're going to need assistance from the richer parts of the world.
Well, there's a number of things that we can do. One is that we can improve the kind of health systems and public health infrastructure in low-income countries. Obviously there is a lot of work going on trying to do that, and climate change is just an added impetus really to improve the situation. Secondly, we can try and improve specific, what's called adaptation to climate change. In other words, there may be some things specifically that can be done, such as heatwave early warning systems. In some cities, for example, heat waves can cause quite large numbers of deaths, particularly in elderly people, but not entirely in elderly people. And so in a number of cities around the world, warning systems have been set up to give populations early warning of a heat wave and to allow particularly the elderly people to get the kind of support, rehydration and so on that they need. There are other potential things we can do as well, and one of the things we mustn't forget is that there's already about 2 billion people in the world without access to clean energy. So one of the things we need to do, whilst reducing greenhouse gas emissions for the rich countries and the developing, the mid-level, mid-income countries, we also need to improve access to clean energy for poor populations, because many of them are being harmed by lack of access to clean energy today, because they have to depend on highly polluting fuels such as biomass, dung, coal burnt indoors. And so we need to address these twin problems of excessive exposure to indoor air pollution on the one hand, caused by lack of access to clean energy, and the need to radically reduce our greenhouse gas emissions to prevent climate change.
The London conference may be some distance from the situation facing many people in Africa, but the Commonwealth is pushing for action. It's looking for genuine solutions, and that pressure could bring real and specific help in the long run for some of the poorest and worst affected by climate change.